everybody. This is the Thurston County Board of Health meeting, April 8th, 2025, starting at 3:47. Welcome, and the meeting now is in session, and the first item on our agenda is the approval of the April 8th, 2025 Board of Health meeting agenda. Is there a motion to approve the agenda?
So moved.
Second.
All right, so moved and seconded by Commissioner Fournier and Commissioner Klaus. And now I will take a vote for approval of the agenda. All right, so all in favor?
Aye.
Aye. Any opposed? All right, so the April 8th, 2025 Board of Health agenda is now approved. The next item on the agenda is approval of the March 11th, 2025 Board of Health meeting minutes. Is there a motion to approve the March 11th, 2025 Board of Health meeting minutes?
So moved.
Excellent. Heidi Knievel. And a second,
Second.
Commissioner Mensah. And all in favor of approving the minutes?
Aye.
Aye.
Any opposed? All right. Oh, and we have also, I'll try to keep my eye on the screen for you to Tanzania. All right, so the March 11th, 2025 Board of Health meeting minutes is now approved. And now we get to do, the next order of business will be to proclaim the month of April 2025 National Child Abuse Prevention Month. And I will invite 3 people to the desk. We will have Dr. Joyce Gilbert, who is a pediatrician at Providence Health and Seattle Children's Hospital. Christy Peters, Chief of Staff at the Prosecuting Attorney's Office, and Jessica Shin, Special Victims Prosecutor.
Good afternoon.
Hi, welcome.
So I'll start just briefly because I'm here simply to just introduce Jessica Shen, who's one of the very hardworking 2 members. We only have 2 prosecutors in Thurston County prosecuting all child sex abuse and adult sex and physical violence.
Introduce yourself too, please.
I'm Christy Peters
Thank you.
as Chief of Staff, and I was introduced already by Dr. Beth Harvey, but I'll reintroduce myself.
Yeah, the three
So,
of you came up at the same time though.
Jessica Shen is the Special Victims Team, one of the 2 dynamic duo. And I also just want to acknowledge that Sky is present, our courthouse dog, who is working primarily with child abuse victims. And Sherry Landon is her handler and victim advocate working with those cases.
All right, well, thanks for having us here. Jessica Shen, Deputy Prosecuting Attorney in the Special Victims Team. So just sort of briefly, we've had a busy year like we had last year. For felony Special Victims Team cases, so that includes adult sex crimes as well as crimes against children, both sex crimes and physical abuse. We had 244 received cases, so cases that were referred to us over arrests. We charged 89. This year, and it doesn't mean that the other ones were not charged, they're just, we can only charge so many at a time, and so those unfortunately kind of go in the backlog. And then this year, last year in 2024, we had 218 received cases, and 85 have been charged this year. In 2024, we specifically charged 32 cases involving children. We've been, as part of the process, we are lucky to have really great community partners and it's a team effort. Right now, my counterpart, Olivia Zoe, is currently in trial on a child sex offense case. The victim, I think, is going to be on the stand tomorrow. She was 6 at the time when it happened, and I believe she's 8 now. I had a trial in September where we had a victim who was 8 at the time, and she was 9 during the testimony. We kind of had our multidisciplinary team partners involved in that trial, and we had the forensic interviewer from Monarch who was there and she testified. The interview that she did with her actually got into evidence. We had the medical evaluator also testify. We had Sky there to support the victim, who was really struggling on the stand, as you can imagine, and we had to take a break for her. And Sherry and Sky took her on a loop around the building for her to kind of calm down and be able to testify. And then we kind of prepped her, and so there's sort of a team surrounding us, and so we're doing what we can do, and so yeah.
Thank you.
Hi, everybody. Thanks for listening to us. I'm Dr. Joyce Gilbert. I'm the medical director of the Providence Abuse Intervention Center. We see between 350 and 400 children a year in our clinic. We do serve 5 counties, so it's not just Thurston County. But what we see every year has been physical abuse, sexual abuse, child maltreatment, and unfortunately now child torture. And I hate to say those words out loud, but it's true, it's real. Kids are in bad situations in our county, and we need to give services to these kids. And one of the most important things for everybody to understand is the abuse can come to an end, and we can reroute the children, and we can change the trajectory of their life, but there is damage. There's brain damage, there's body damage, there's self-esteem damage, there's all sorts of things that go lifelong. So what we do as a community is we recognize and we change what's going on in these kids' lives, but then we don't just think, oh, that's saved. Oh, that's done. We're all good now. What we have to remember is these kids need ongoing therapy for the rest of their lives. They need support in school at every grade. A child who is abused in 2nd grade is going to still need help in 10th grade. And sometimes we all forget that as adults. We get to a point where we say, oh, great, everything's fine now. And it's not. So one of the things I do is I do outreach education everywhere, to schools, to counselors, to medical providers, to anybody who will listen to me. And I talk a lot. And I explain what happens to a child's brain and body when they've been abused in any way, so that our communities can understand that that's the support that we need to continue giving. Thanks for your time.
Thank you so much for coming. Are there 2 or 3 questions that anybody might want to ask?
I'm curious about how our community can help you in your work, and thank you for what you do.
I think acknowledging that child abuse occurs. I think open eyes and open doors and open ideas about how do we prevent it, and that's by education. How do we respond to it when we know it's happening? And that's by having all the right people in all the right places. Justice is important. Counseling is important. Services that support a child in school and sports are important. So I think every aspect of our community can come together to support kids in every aspect of their lives.
I think Dr. Gilbert explained it.
I think just for, as far as Thurston County itself, we work really hard with the law enforcement agencies together to coordinate and communicate. And I think continuing to train to have absolutely the best detectives that are really good working with little ones and the best attorneys. We don't choose anyone to do these types of cases. And the support that we can get from Thurston County and the Board of Health in that is very helpful. And I think if Sheriff Sanders were standing here, he would say the exact same thing on behalf of the Sheriff's Department.
And Jessica said this is a multidisciplinary team group effort. We all work together, we all collaborate with each other, and that's how we get the best for the kids and the families.
I had a question for you all. Hi, I'm on the screen. I'm Tanzania, part of the Board of Health. My question is regarding, if you could just maybe give even just qualitative background or feedback regarding the amount of cases that you're dealing with of child sex abuse that is directly related or correlating from human trafficking, and then what the interagency coordination and support looks like that regarding how you guys make decisions when the trafficking aspect is involved.
We actually see very low instances of child trafficking. A great deal of that really comes from our office perspective. We only would see it if there was an investigation from the Thurston County law enforcement agencies. And majority of the specific areas that the training and where individuals like that are actually arrested happen in the larger metropolitan areas. Not that we don't think it's happening here, we just don't have that many referrals or arrests in that area. Do you have any to add?
Yeah, I would say mostly for those, it seems like that it requires a lot of resources. I feel like usually that comes out with stings, and so I think like Christy said, it kind of requires much more of a coordinated effort to do that. I think the vast majority of our cases involving children and when really adults too are people who know the child, so family, family friends, people, adults in their life. That's the majority of the cases that we see here.
Do you see that?
I would say from a medical aspect now, we are aware of signs and symptoms of trafficking in medicine. So emergency rooms and walk-in clinics and things, we're knowing what to look for and what to tease out. But I'm gonna agree with the prosecutor's office, we just don't see the numbers here because of where we live and who we are.
Well, I would really like to thank you all for coming. I do have one final question. Do you think that you've seen any impacts from technology and like Roblox or, all the kind of social media apps or other things that you think maybe are making kids more vulnerable? Or do you still think it's mostly friends and family or people who have close contact?
I think technology definitely plays a role. I didn't even know what Roblox was until I got a case that involved it. I've seen a few of those. I think it does make access easier in some ways, especially if they're, if they're able to chat in those sort of areas. Or Instagram, you can Instagram message somebody and, maybe the parents don't know. And so we've seen a couple recently involving strangers, but I would say still the vast majority of hands-on offenses. I think a lot of times those cases where that's involved, it tends to be more communications with a minor for immoral purposes or sexual exploitation of a minor, which is you're trying to ask for something in exchange for sexual contact or intercourse. A lot of the hands-on one tends to be people who they know, but a lot of those, we do see a lot more of that possession depictions and communications with that sort of set of facts.
Raises a question for me. So like you mentioned sting operations and Dr. Roberts talking about technology. Those I don't know what they're called, but like where there's some, kind of controversy about whether or not it's an effective tactic for detectives, or they're like net nanny, or what was that what it's called, where they pose online to look for child predators. I mean, is that, what are your thoughts on that as a tactic? Because there was some legislation about banning it. There were some people about how useful it is. What do you thought? What do you all think?
The last time that we had a net nanny case in Thurston County, and don't quote me on the year, but it was a few years, maybe it started, I want to say right before the pandemic, 19 or 20.
That sounds right.
And our office was so overwhelmed by, it was only up for 24 hours. And we had about 42, 43 defendants from all over, not only the state of Washington, California, Oregon, people that actually traveled within that 24-hour time period to this essentially made-up apartment in Tumwater, where they thought they were going to meet a child, which they were not going to meet a child, and it literally took all the resources away from the regular caseload of Thurston County. So the reality is you could probably set that up pretty much anywhere and have just overwhelming your caseload. It took about 4 to 5 years to get through all of those cases.
So workload aside, you're
Yeah.
saying it is a useful, important tool? I mean, if you're casting a net and you're catching fish, then it works regardless of whether you want to catch the fish or not, right?
There were and I see what you're saying. We're trying to prioritize the hands-on offenders the most. Out of those individuals that were arrested, they found that about 10% had been hands-on offenders versus going to visit what they thought was an image or a mystery, if that makes sense, that they were able to catch. So I don't know, that's what we found in our group. I know that in Tacoma, Pierce County, Kitsap County, King County, and actually Lewis County have had similar situations where they've had a lot of people, but most of them were interested in on the online chatting type of thing and sending photos versus the hands-on, if that makes sense. We were trying to prioritize.
Good tool, bad tool.
I don't know that it's a good tool or a bad tool. I think it's really hard to tell because it's shifting all the time. As far as can you get people charged with these cases? Yeah.
Okay, Thank you.
Yeah, you can.
All right, well, let us go on to reading the proclamation, and I don't know if anyone has it pulled up on the end.
Page 7.
You wanna start, Perla? Is that okay? And we'll come this way.
Thurston County Proclamation National Child Abuse Prevention Month. Whereas children are the foundation for a prosperous and innovative society, and the foundation for a child's growth and development is established when every community takes responsibility for creating healthy environments where our children can thrive. And
Whereas a child's early experiences of being nurtured and bonded with consistent, caring adults affect all aspects of behavior and development and are associated with better academic grades, healthier choices, improved physical and mental health, positive peer interactions, and an increased ability to cope with stress. And
whereas the number of child abuse victims in Thurston County continued to increase in 2022, with 2,532 victims referred to Child Protective Services and accepted for further action. And in 2022, Thurston County's child abuse rate of 40.53 victims per 1,000 children was higher than Washington State's child abuse rate of 35.35 victims per 1,000 children. And
whereas Thurston County recognizes it is the responsibility of every adult to protect children from all forms of adverse childhood experiences, including abuse and neglect, and recognizes the need for adults, organizations, schools, and communities to form protective barriers around children. And
Whereas effective child abuse prevention programs are essential and exceed because of community partnerships created among citizens, social service agencies, schools, businesses, law enforcement agencies, faith-based organizations, civic organizations, and other child-serving agencies. And
whereas Sunday, April 27th, 2025 is Go Blue Day, a day when everyone is encouraged to wear blue to build awareness about child abuse and neglect prevention, and to inspire change by focusing on community activities and public policies that prioritize prevention. And
now therefore be it resolved, the Board of Thurston Health hereby proclaims April 2025 as National Child Abuse Prevention Month in Thurston County and urges all residents to actively participate in the care, well-being, and protection of our children. Adopted this 8th day of April 2025.
great, and now we can go out and take a photo.
Can wheel for the photo?
And any of you in the audience who would like to come up for the photo as well too.
yes.
Out on the stage.
Yes, please.
All right. The next order of business is the opportunity for the public to address the board. And we will have one person that I will call up in a moment. First, I will just clarify kind of just how we do it. Thurston County Board of Health welcomes comments from the public at all meetings. The following are guidelines for public testimony to ensure that they are appropriate and do not take advantage of the televised nature of the meeting. All individuals testifying will provide their name and address. Testimony will be addressed to the Board of Health members, not to the audience, cameras, or staff. Cell phones will be silenced. No responses provided by the Board of Health following testimony. As needed, the Board of Health clerk will follow up on specific items. Speakers are limited to a total of 3 minutes. Speaking time may not be shared between individuals. The Board of Health reserves the right to restrict an individual's opportunity to address the meeting for a good cause. Lewd, offensive, inflammatory, hateful, defamatory, or discriminatory comments will not be allowed. All materials provided to the Board of Health may be considered public record and subject to public release upon request pursuant to the Public Records Act, Chapter 42.56 RCW. No outbursts of any kind, no comments that are commercial in nature, such as promotion of a for-profit business. And I'll have Mr. Brett Trowbridge come up to the mic at the podium, and then you'll be able to see your 3 minutes up there, and we'll give you maybe a 30-second heads up. I'll give you a little flash.
So I see the timer is at 3 minutes. Is there a new rule on that?
Mr. Trowbridge, can you please stand at the lectern?
I can barely stand, but I'll try.
Thank you.
Why don't we just give him the mic and he can sit?
Again, I'm complaining about the 3 minutes.
What would you like for me to do?
Yes.
You can sit if you could, yes.
I shouldn't even.
Come sit down if you like.
Yeah, we're mean. We only allow like the invited speakers 3 minutes too. So just let's kind of stay on task
Is this thing working? It's on. Yeah, you're good. It's for the Zoom.
so they can hear.
So, I just handed out a written thing, as I usually do. Next time I'll bring flowers too. I just want to talk again about my favorite topic, which is the McAllister Springs geosensitive area. Most of you probably haven't heard of it before. You know, when I brought it up in front of the county commissioners, not a one of them had heard of it, which I was surprised then, but I can see why that is now, because it just pertains to a small area of the county, and unless you live in it, and unless you lived in it back when they established this in 1988, you probably never heard of it. But that doesn't mean it's important, and not important. Who established it? You guys did, your forebears. The Thurston County Board of Health established this under H588 in 1988, a 2-year temporary zoning change where houses would have to have 5 acres to have a septic tank. And in 1980, your forebears, you guys, the Board of Health, voted to make that new district permanent. So it's existed now for 37 years, protecting our main water supply. Why? 2 main reasons. One was that septic tanks were thought to release too much nitrogen, too many nitrates into the groundwater, and we already have high nitrates in our groundwater, so they didn't want them to go any higher, and they said they were rapidly increasing, so they didn't want to have very many septic systems for fewer nitrates. The second reason was just to have fewer chemicals in general. It was sort of aspirational, you know, the railroad should work toward not having any spills. County highways should be engineered so there's fewer accidents. But included in that is what I've written here. The county should not utilize any chemical methods for the purpose of maintaining county property, such as roadsides or parks within the capture zone. So now this thing is available online. All you have to do is Google McAllister Springs Geologically Sensitive Area Resource Protection Report. And I've talked about that with the county commissioner several times. They're all familiar with it. So it looks to me like if there really are people who want to put pesticides into our lake, that they're in direct violation of the county's 37-year-long policy. And they want to abolish this policy, and they want to put pesticides into our drinking water. What's happened? We started at 3 minutes. Now we're at the end of that. Am I done? It's a 3-minute rule now? Okay, well, I'd sure ask that the rest of you read this, every bit of it, and ask the people who are for this why they want to start doing this. Why do we have to poison our drinking water? We have an alternative. Just use harvesters or just pull the lily pads out.
All right, public comment is now closed. Thank you for coming. Next order of business is a presentation of the fetal and infant mortality review provided by Lisa Osler and Dr. Joyce Gilbert, who will have come up and give their presentation.
My name is Lisa, Lisa Osler. I work at Thurston County Public Health Social Services, and I do the child fatality review and the fetal infant mortality review. I coordinate the teams, meetings, and I gather all the necessary information. So I just kind of wanted to come here and focus more on the femur because it's new. It's also exciting because we're the only county in this entire state of Washington that reviews fetal deaths. So that's very exciting.
Why is that exciting?
It's exciting for us.
I look
but
at their
it's-
faces
I know.
and they're not excited.
It's exciting because we're actually researching why there are stillbirths and miscarriages. No one else in the entire state is researching that. It is being deemed natural. And if you ask any person that has experienced that, they will say it is probably the most unnatural experience and very traumatic. And we want to know why. We want to figure out the why. We want to figure out how we can prevent. So I don't know who I say next. Yeah. So just some background information. Fetal death. It's any fetus 20 weeks to delivery, but they did not take a breath. Okay, so then infants is from first breath to 1 year. So that could have been less than an hour that they were alive, but they'll still be considered an infant. It's a very community focused, it's a multidisciplinary team. There's myself, there's a few others from Thurston County Public Health, Dr. Gilbert, the coroner's office, law enforcement, medics. Both hospitals are involved. It's a great group that comes together to try and figure out where did we go wrong with this family? Where was a gap in service? We look at the social determinants of health. Was there child abuse involved? Was there neglect? How could we have helped? Should we have, done referrals to NFP or Finch? How could we have helped that family to prevent?
Yeah, basically, was it preventable?
Yes.
That's
yeah.
what we wanna
And
know.
How, and then what steps could we have done? So we don't just look at the quantitative data, which is why I really love the FEMUR program, is I reach out to the families. I first send them a letter and then I follow up within 7 to 10 days with a phone call, and I give them the space to share their story. I give them the opportunity to tell me everything from the moment they were pregnant to the moment they lost their child, their experience from their voice, their lived experience. And we don't tend to get a lot of that. So with some of these research. So next slide, please. So some of the initiatives and recommendations, we've been doing the reviews now for since October. So we started the team in this January of 2024. We spent 6 months educating and growing as a team. And then in September, I believe, we started doing reviews. So in that time, we have realized that in our county, so we're just reviewing Thurston County, Some of the big things that we're seeing is a decrease in fetal movement and parents not going into the provider. We're seeing gestational diabetes and parents not being thoroughly educated on just the extremes of gestational diabetes. We are seeing high blood pressure, preeclampsia. We're seeing people going into the hospital and being discharged and then turning back a week later, having to deliver a stillbirth because they were not heard in that moment. So we established an in-person bereavement support group, which was not present in Thurston County. There's some lovely online virtual support groups, but we really wanted to do it in person. So we do that on Lily Street once a month. And then we also, May 12th, we will be launching the first Count the Kicks campaign in the state of Washington, and that's an app. It was invented in Iowa, and over a 10-year period, the state showed a decrease in stillbirth by 34%. And so it teaches families to count the kicks, literally same time every day during the third trimester. And it now empowers them too. Now they have this data to go into the hospital and say no, look, something is different, something I've been tracking this for 4 weeks or however long. And it also teaches them to also connect with their body and how their body's changing as well. Next slide, I think that's, our goal moving forward is we want to collaborate more with healthcare providers. I want more to know about FEMUR. Slowly but surely, I'm getting the word out. We all are. We're new, right? So it does take time. Just especially more community leaders, policy makers, because it takes a community, right? It takes a community to raise healthy children, and fetal and infant mortality, it's a clear reflection of our overall community's health. So if our fetal and infant mortality is going up, it's a clear indicator that we have an unhealthy community.
And when it goes down, it's a clear indicator we're doing something right. Yeah. This is a national model, so we didn't invent this. Lisa and I didn't invent this, right? We are going off of a national model. We are the first county in the state of Washington, but we've actually been trained by other people who've been doing this for years. And it is an amazing program. I jumped right on board because I have exceptional training, also somewhat excessive training in infant and child mortality. And I sit on the child death review team. I've done homicide investigations with law enforcement. I've been, part of my child abuse is also how can we prevent these deaths in our community, right? So as soon as Lisa said, we're gonna go for FEMUR, I'm like, sign me up, I'm right there with you. And it has, just in this short period of time, the ability to bring Count the Kicks into our community is fabulous. The ability for me to go back to other medical professionals within our community and say, hey, we need to work on this a little bit, or we noticed this. Let's shore up what we're doing as medical providers. So there's so much that can come out of this. We are so jazzed about this. I know it sounds really bizarre to be really excited about fetal and infant death, but when you can make a difference in your community, that's where that passion comes from.
Yeah, and so we've just had 3 or 4 actual review meetings, and to already be putting our recommendation forward with Count the Kicks next month is just amazing, and I'm so excited about it. So it just goes to show what we can do when we have this 2020 vision, when I get all the records, law enforcement, medics, medical, the hospital records, if there was in-home nursing, we get all of these records and we go through them as a team. It gives us profound vision that most people aren't able to have in the moment, but then we can take that back into the community and say, hey, look where we went wrong or we missed,
Look what we can do better.
Yeah.
Do you have data to share?
So data's hard.
Kind of not yet.
Yeah, not yet, because of the small number.
Yeah.
Yeah.
And we met last year and talked about that, but I was wondering
And so it
how that
has,
gone,
it has
collecting data.
increased. So I believe when we met, it was 5.6 per 1,000, and now we're at 7. So we have increased, but because of,
It's a small sample. though,
It's
so
small
hard to-
samples, yeah.
yeah, which I always have a hard time wrapping. I'm like, but they're people. No. But yeah, we are increasing. We're up there with high numbers, so.
Did you have a question, Tanzania?
I do, yes, thank you. So it's a little bit of a piggyback off of Commissioner Fournier's, but the slide that stated like the qualitative data and family narrative, I do recognize that those things can be very informative when you're trying to sort of create a new way to collect data, right? That's not just based on like numbers, but I'm curious of like internally, what is you guys' idea about the metric system in which this data will be measured against? Meaning, like, if you sit down with a mother who has experienced this and you listen to her story and her journey throughout her pregnancy, how are you utilizing, outside of like storytelling is really powerful and impactful, from a data collection point of view, or like regarding funding and, you know, down the line and things like that, what conclusions are you getting from those conversations if there isn't a metric system? Does that make sense?
Kind of, I'm gonna see if I understand. So we take those stories and bring them into the review meeting. And so let's say we review 5 fetal deaths in one meeting. And if all 5 of those cases that we're reviewing experienced a decrease in fetal movement, then we're like, okay, something's going on. This is, you know, all 5 here have experienced it. That's to say that there's a lot more. So then we kind of go out and we do our research, right? We look at what's going on. Unfortunately, we can't in the state because nobody else is reviewing fetal fatalities. So we look at the broader. I sit on national teams for FEMA reviews, and I do my research and I gather it that way. Because we're the first, it is difficult with data. I reached out to Snohomish County to let them know that their numbers have gone up quite a bit, but they don't review, they don't keep track. So we don't really have anybody to bounce the numbers off of, and we're working closely with our epidemiology team to try and figure out how do we move forward with this new team so that we can both have the quantitative and qualitative data. But really right now, it is because of the small numbers. We rely on the story, and it's profound, you know, to hear personal stories for sure. I don't know if that helps.
One more just example. Again, we're so young and new that it is hard to have that data, but one review, we had 3 fetal deaths and they were all diagnosed with gestational diabetes. And I, the medical professional, came into the meeting saying, everybody has gestational diabetes. It doesn't cause fetal deaths. And then I said, oh, wait a minute. And, you know, and so even as a medical professional, I have to back off and say, yeah, there are a lot of people diagnosed with gestational diabetes, and it can cause a fetal death early on in the pregnancy when it's unrecognized and untreated. So getting that information, then we can go back out to providers and say, this mom said she was diagnosed with gestational diabetes and she didn't understand how to follow the right diet. Let's try to educate our providers that they can do a better job of that.
And the education starts 3rd trimester. How can we bring that into the 1st trimester,
Right.
pre-pregnancy? So like it's preventative, right? So like we don't, maybe like one day I'll be out of a job. Like we're not reviewing these anymore, you know, because we're able to put this stuff forward and educate and get the community involved. Yeah.
We'll have more information next year, promise. More data.
And can I ask also?
Thank you so much. I'm so sorry. I did also have another question. And I really appreciate your feedback, and I do agree. I think the work that you guys are doing is kind of groundbreaking, and so I recognize when you're in that sweet spot of starting something new that you're still trying to figure out the best way to grab info. So I respect that. My other question was, what is your opinion regarding maternal and prenatal care as the utilization of doulas as like a preventative measure for families?
I don't have enough experience to have a comment.
I will say that March of Dimes, correct me if I'm wrong, I think it was 2023, March of Dimes came out and said that the two things that Washington State needed to do to decrease their stillbirth rate was create a FEMA team and have doulas covered by insurance. So I can say that, like that was what
And
March
the
of
state's
Dimes.
done that. The state took that measure last year.
And we're doing the FEMA team. And so, and because I'm also do the child fatality review, so we do a statewide meeting every month. And so I present on what I've been doing in FEMA. And so it is getting, like Pierce County's really excited and other counties are getting excited to start their own FEMA team as well. I hope it spreads because, yeah.
Has there been any thought, like of your team or public health doing like a doula awareness or doula education? Because I mean, it's a thing that exists, but it's not really a thing that's widely known or accepted or utilized. Is there any thoughts on, you know, a countywide effort to promote that industry?
No, but it's not a bad idea, yeah.
Not at this time.
Yeah, not at this time, but yeah.
Just find the money.
Commissioner Grant.
Yeah, I guess I was just gonna ask, what the relationship, I think you just touched on a little bit, with statewide Department of Health and how they're utilizing this information, and are you feeding into that so that we can take this statewide? And I also want to mention that I just think this is incredible work, and, you know, that you literally are saving babies, future babies, and so, thanks for that. I just wonder why Department of Health isn't, or the larger one, yeah.
So there's the data sharing agreement that is above what I fully understand. So when we review, there's a database for the National Center of Fatality Review and Prevention. It's out of Michigan. So that's kind of the umbrella that we work under for the reviews. So all of the data that I get, I put into their database system. And there is a data sharing disagreement with the state and Michigan that they're working through, but then with things that are happening in the present moment. So we're trying, but it seems that it's just obstacles and obstacles. When I was first creating this, I met with Angie monthly and would keep her up to date and very supportive. Yeah, we're pretty alone
Safe to say
on it.
that the work that we're doing is ultimately, hopefully going to spread statewide, which
Yeah.
is really incredible. I just want to say thank you for that.
Thank you.
And that they'll be following your lead.
Yeah, and there are a lot of other counties that are interested, so I think once we get more interest, then they will just pay more attention.
There should be a snowball effect.
There should be, yes, yes.
All right, Councilman Gilman.
Dr. Joyce, it piqued my interest describing somebody who had signs of diabetes during pregnancy, so there would be diet suggestions for them. And I'm wondering, there were a couple, the fewer kicks, what are some of the interventions? And similarly, you mentioned that if people had, either the hospital staff had been more aware, or clinic staff, or the patient had advocated in a different way, that there might have, what are some of those interventions that might save one of these
Great
babies?
question, lots of good medicine. So there's lots of good medicine now about count the kicks. If you don't have the same number of kicks in that time frame every single day, something's impeding blood flow to that baby. And that impeding of blood flow can be the placenta separating, or it can be a knot in the umbilical cord, or it can be the diabetes causing too much trouble. There's so many options of what it could be, but you gotta go seek medical care to figure it out. And then they put the woman on a monitor for a period of time, and it's called a non-stress test. And we see if that baby's reacting like it should. And if that baby looks stressed, she doesn't leave the hospital. So that's the intervention. The intervention comes because she was noticing less kicks. Be it 28 weeks, 32 weeks, 36 weeks, whatever, we have to pay attention at that moment in time because that baby's in trouble. Yeah, and we save lives because they come into the hospital and we pay attention. The times when women have not advocated enough for themselves, they maybe didn't say it the right way, or somebody listened to it a little wrong, or they reassured somebody that you were really okay, and maybe they didn't do all the testing that needed to be done. It's a variety of different reasons. And so again, it's just that getting that word out to all providers and to all pregnant women, this is what you need to do. And Count the Kicks is such a great national program that we're just so jazzed to bring it into Thurston County.
Wow.
Yeah.
Well, thank you
Thanks
so
for the
much
time,
for
guys.
coming, and obviously, we're very interested, and our data team and our communication team, if we can be of help, let us know.
Right.
Thanks
Thanks so
again for
much.
taking the
Thank you.
time.
Yeah, thanks for letting us talk.
All right, the next on the agenda is an update on the Board of Health subcommittees. And we've had two of our committees meet. So I think our first one we'd like to hear from is just an update from Education and Outreach Subcommittee.
Yeah, so, thank you. We met on March 28th, and, we were continuing the conversation about the ambassador program that we brought forward, as an item last time. We're continuing to kind of work through the details of that, and, this, for those who maybe don't, just to kind of like bring people up to speed if you don't remember or if you weren't here, the ambassador program is something that we are considering implementing. We're thinking like next year so that we have time to fully discuss this and figure this out as a board. But it would allow Board of Health members to kind of take on like direct community engagement as it relates to the proclamations that we pass as a board. So in your packet, on the very last page, 14, you'll see a list of the Board of Health proclamations for this year. And of course, we're not talking at this time about implementing any sort of new program this year. We think it might be too fast to do it that way. We want to make sure people are comfortable with it. And one of our biggest concern might not be the right word, but like one of the biggest considerations is we don't want to impact staff time. We don't want to have staff overloaded because we're trying to implement a new program. This is more so an opportunity for Board of Health members to get out there in the community, directly connect with people who might be coming in to present for a proclamation, and kind of be the person that guides them and brings them in and sits with them and talks with them beforehand. And all of this would have to be laid out kind of in a communications plan that we're talking about at the subcommittee meetings, so that we're not overloading staff or accidentally committing to things in the community that we can't actually commit to as a board. So we would need really, really clear parameters on what this program entails. But it would also give Board of Health members the opportunity to kind of champion a cause that we really care about. So as an example, we might like look through the Board of Health proclamations and people could kind of like put a check mark or something, like some sort of indication to staff that they're interested in reaching out to the community, or like, for example, the International Transgender Day of Visibility proclamation that we passed last month. We actually flew the transgender flag here at the atrium on the 31st, which was a really great way to follow up a proclamation with direct action. And that's kind of one example of like things that we could bring to fruition with this ambassador program by having Board of Health members who are directly involved with some aspect of the proclamations that we're passing as a board, to kind of suggest direct action or just bring community members in and kind of build that public trust. So that's what we're working on. And we kind of talked through like two different types of processes to limit the impact on staff time, because staff already do have a process for proclamations, and so we don't want to reinvent the wheel. If there are some proclamations that don't have any interest, then staff could kind of just do status quo process like they know how to do already. So those are the kinds of things that we're talking about at the Education and Outreach Subcommittee meeting. And if there are any questions, I'd be happy to answer them.
Any questions? All right, thank you so much.
I want to have like a serious full exploration of that concept before we roll out anything. I'd have lots of questions, and there's lots of concerns that pop up right off the bat when, when I just think about it functionally. So the ambassador concept, there's red flags for me, so.
Do you do you have any questions that you wanna ask, or we could maybe chat, another time if you have questions or concerns, but I'd be happy to answer any questions you might have. I understand that red flags might pop up because, like I said, we really don't wanna impact staff negatively. So some of the concerns that we had, I shared in my update, but if there are additional concerns you have or questions, I'd be more than happy to answer them, because this is something we're really excited about, and we wanna make sure we roll it out correctly, which is why we're like, let's not do this immediately, let's talk through this all year long and make sure we get it right, so.
When you say we, are you talking about the subcommittee, or are you speaking for the whole board, or are you?
Well, the subcommittee at this point, because the full board hasn't really.
Yeah, I mean, I'd have to think it through. I look forward to future discussions. The structure of a board is, I see it in such a way, when I start hearing something like that, it reminds me more of like a committee style government, like they used to run Chicago with, where each individual, when a board that is comprised of a group of people that have to get together and build consensus and act together united, that is very different than when you have a group of people where each individual essentially has an aspect that they're kind of responsible for. Then it becomes more like a commission style of government. And that historically has been problematic. If you kind of do any historic research on just the way that American government is kind of played out. When you think about like old school Chicago government, the police commissioner was kind of off on their own, doing their own thing. The commissioner of public waste was off kind of doing their own thing, and it's it's detrimental towards cohesion and alignment. So I would really, really want to think that through, because we're a board, and when we're joined together is when we have decision-making power, and it's through the collective action. And you can from time to time delegate specific things like ad hoc to subcommittees, but in my mind, it's dangerous to say, well, I'm on the Board of Health, but I'm the commissioner of this thing, and Dr. Harvey's the commissioner of this thing. And if you over-delegate that authority, it's kind of hard to reel it back in, and then it's hard for us to collectively kind of control the will of the board. And it can end up where different commissioners can probably get out into dangerous territory where they're not necessarily in alignment with the board. So it's just, from a functional, practical standpoint, it just makes me want to pause.
We do have room on the subcommittee if you want to join and be part of the conversation.
I look forward to talking about things as a committee of the whole. So.
Right, okay, sounds great, thanks.
I have a question too, if that's okay. So are there any discussions with the education or outreach, any topics like they count the kicks, can we support that? Or with the walking month, or like times like maybe twice a year where we're out in the community and we're like, we're all gonna go walk at this park, do you wanna join us? Have there been discussions of any of those kind of things?
Not that specifically, but that's like a really good idea, and conceptually, that's kind of like what we're talking about, is like, what are engagement points that we can all agree on as a board? And what are the parameters of those points of engagement? Because like, Commissioner Fournier pointed out, we don't want people just out there in the community representing the full Board of Health and not actually doing things that the full Board of Health said we could do. So things like that are great examples of ways that like someone on the Board of Health could be like, hey, I want to be an ambassador for Child Abuse Prevention Month because that's something I really care about. And then they could go talk to the people, the people who present and say, hey, what are some ways that the Board of Health can actually support this? And that would be a really good way of making sure that we are following up with direct action where, as it is currently, we have people come in and sit down and we say, thank you so much, how can we support you? And then making sure that there's follow through there. I mean, there's just not a whole lot of capacity to make sure every single time we ask, what can we do? There's someone following up. But this would be a way to proactively do that and figure that out beforehand so that when we come forward, the board kind of has an idea of what we can do to actually support these proclamations. And I think it's a really important way of like building public trust because we want to put action to our words. We don't want to just pass proclamations and then move on. So, yeah.
All right. Any other questions? Great, thank you so much.
Thank you.
All right, and then the data subcommittee, I think, just met yesterday, so I don't know if there's an update yet.
Yeah, we have an update. So we met yesterday. So the exciting news is that there's a health report that's coming out by the Public Health and Social Services that I believe the commissioners already got. Yeah.
County
County
commissioners have received it.
Yeah. So they completed a health equity review that compiles data around social determinants around for health outcomes in Thurston County. And so the report is called Journey to Health Equity, Health Disparities Within Thurston County. So it's a non-actionable data report. It's a 25-page report, which is kind of like an analytical snapshot of key indicators that reveal inequalities across different demographics within our county. So there's a communication plan in place that kind of includes website with the entire report, press release, social media. So in the subcommittee, we are excited. We want Board of Health members to feel empowered to share this in the community and to reach out if there's any questions or if they need any clarifying information. But we want this report to be promoted in the community because it has a lot of really good information and there's no way to help health disparities without acknowledging them first. So,
Dr. Fry, you sent that report out
Yeah,
how long ago?
it's on the 5th of March.
Okay, so yeah.
Thanks. Great. It has only gone to commissioners because of the meeting just happening yesterday. We weren't able to add it to the packet, so it will be added to the May agenda. You'll have it ahead of time to review the report, the communication plan as part of the May agenda.
yeah. Any other questions? Just a quick update, the community health needs assessment is being worked on with the Public Health and Social Services, and hopefully they'll wrap up in the next couple months. After that, they want to start reviewing, doing a community health assessment for Thurston County from the Public Health and Social Service Department completely, so. Yeah. Thank you.
Yeah, thanks. Any other questions? All right, thank you so much. And then the policy subcommittee has not met, but will be in a week. So we'll get an update next time. And then the next order of business is just on page 11. If you have reviewed the health officer and director's report, if you have any questions, we can, Jen, if you have any.
One other comment, the page before that on page 10 are some answers to questions that we didn't have answers to last time. So there are responses in there.
Thanks. And if no questions, we'll move on. The next item on the agenda is the open Board of Health discussion and information sharing. And we had 3 topics suggested. Feel free before the next meeting to share any other suggestions or things you want us to put on the agenda, and we'll add them for next month. So first, Jen, do you want to do the update on the pause on public hearing for board composition changes?
Yes, there is some state legislation that may come about that may alter the Board of Health composition. So where we were originally going to have the public hearing 2 weeks ago, it was put on pause while we wait to find out more about what's coming down through state legislation.
Can you share what the possible changes may look like, what the, kind of what's on the horizon, what's being talked about?
Yes, it is still being edited in some forms, but it is basically looking at offering a seat to each tribe in a county that has 5 elected officials, and whether they're a district or not, a public health district. And so, so that could alter the number of seats that we have. Right now, we have Squaxin tribal seat as 1 seat representing all of our tribal nations, but this could add additional seats to that. And then we would have to look at what the composition is based upon those 3 categories that we have to have community members in and alter that.
And then we have to have a balance between elected officials,
Correct.
and so it could completely overturn.
Have to adjust as it comes, yeah.
Where is that bill at in the legislation? This is Ray.
I think it was with Senate rules.
Okay.
I apologize if I missed it. What is like the specific bill? Like what is the bill?
We can find that and get it to the Board of Health if you'd like.
And my own, no worries. I just, if we're talking about it, it would, be great to have that specific information. No worries.
Great.
Yeah,
And then,
the goal was to find out how that played out, and then we'd come back and brief county commissioners and then the Board of Health with the details of the bill. So, staff doesn't have that information right now because we weren't necessarily planning to give an update on the bill, just an information that you all were probably expecting the Board of Health composition. Staff did a great job marching that to the finish line to be done, but it's been paused.
And it is Senate House Bill 1946.
Thank you.
Thank you.
great. And then Apple Health letters were sent to representatives. So if there's any questions on that, we did follow through on that. And then we also had the collaborative meeting with the schools, the providers, and the county, and that went really well. So just wanted to update you on that. All right, so we are now ready to meet in executive session to discuss the health officer recruitment update as allowed by RCW 42.30.1101G to evaluate the qualifications of an applicant for public employment. So the board will be in executive session for 7 minutes, so until 4:57.
Just 7 minutes?
That's what I
We
was
can- we
told.
can do it
We
in
can
7
whip it out like that. 10?
Ten?
All right, so
10 feels better.
5 o'clock.
7's just weird.
Yeah, I think we should probably do 15 minutes and then we can extend if needed. The information you have to cover is
0.3.
more than just 7.
Sounds
They may have questions.
All right,
Yeah.
so 5:05,
Okay. Thank you.
15 minutes.
Thank you, Chair. Appreciate that.
on?
Back on Zoom?
Okay. So we're coming out of executive session. We were in from 5:50 to 5:14 and have directed staff for some follow-up. And now we'll call the meeting back, our regular meeting back to order. And the next order of business is adjournment. So may I have a motion to adjourn the April 8th, 2025 Board of Health meeting?
Move to adjourn.
All right, Commissioner Grant, and second?
Second.
All right, Commissioner Klaus, thanks. So all in favor of adjourning our meeting?
Aye.
Aye. All right, no opposed? All right, so then the meeting is adjourned. Thank you, everybody.
Wow.